I was reached out by our HR department to see if my medical staff from the simulation lab could go and work in the hospital. So after speaking with HR, I asked them if they would actually take non-medical people, since I have a mix of both medical and non-medical staff. So after speaking with them, they said that they have, quite a few support roles, and they had just got a request to assist in the COVID testing clinic. So I went back to the team, and they were on board to step up and support the COVID clinic, and then also the support staff at the hospital as well.
I still work full-time at Whitley, but on some of my days off, I pick up extra shifts at PRMC to help with the staffing needs. It was very easy for me to be able to reach out to that department and say, hey, during this difficult time, is there anything that I can do to help alleviate some of the burden of the influx of the patients, or even being able to help with the staffing needs that if someone needs off or something like that. So that's how I started.
Our team has been deployed out 20 hours for COVID help throughout the healthcare system. And we're doing anything from delivering food, dietary, to organizing and cleaning, helping with their isolation gowns, get those ready to go. Just anything that we can do to help them so that they can do their job and not have to worry about, the little things that we can help with.
My staff can be assigned at taking people's COVID test at the COVID clinic, to doing temperature checks at door 11, or working in the hospital, resupplying stock, cleaning the areas, and then also, working on the workflows for the new COVID vaccination clinic that we are working on currently. They are just so thankful for us being there and supporting them and helping them through this time of, unfortunately with COVID.
It's been very helpful, and I can tell that the staff that I used to work with have been very thankful for any type of support. We finally have started getting staff that will restock our PPE there when, deployed staffs, and that's been grateful for us who are working the front line, because even though we could have time to do that, and we might not have time to do that, but having someone there just folding the yellow gowns to put them in the drawer has really made a huge difference.
I personally don't feel like I'm doing much, but when you hear several times like, thank you so much for filling our gown bin, or thank you so much for cleaning that, I'm like, I'm doing this much and you guys are doing this much. The first time I went there, honestly, I could see the tired in these nurses' faces. I could see the redness around their eyes from day in, day out. And those people, they're amazing. They are amazing.
So it definitely has some great emotions that are put into it when going through every day at work. Going into healthcare, you always want to be able to help, whether it's your patients, the patient's family member, or even an extra coworker.
I just hope, the community really helps to continue to slow the spread, and notice and recognize that our hospitals are doing outstanding work, and they're doing the very best they can.
Being able to pick up and being able to help during these difficult times has been very humbling, because you can go home, even walking out to your vehicle from a long shift there, you know that you made a difference. Whether you might not have had great outcomes with your patients due to how ill they are, but you've made a difference with the unit that you worked with.
A lot of the staff that we have, they come from med-surg, or they're coming from working in the ER or EMS. They're coming from, nurses. So they're able to go back and step in those areas and really support. And it's like they never left. They just change, and they're able to go in there and help them and assist whatever the hospital needs. So, looking at everything that they are doing and seeing them support the staff, it really just makes me happy that my team is able to step up and help with what's going on right now.
I think I was a little apprehensive at first, but really getting out there and being side by side with frontline coworkers is really fulfilling. And it's really a blessing, because I've met several people that I would have never been able to meet. It's a really neat experience and extremely fulfilling.